Hello, welcome to our 6th webinar. Today we're going to be talking about ink allergies and removal and how to basically spot an ink allergy, what's our causes of ink allergy, and what we can do with ink allergies. This is an uncharted territory for a lot of people. Dr. Ben and I are hoping to bring more awareness of what you can do. Before Xtract came along, the only thing that you really could do for ink allergies was to be on a ministry of steroids for years, or actually surgical removal. So this is something very exciting for us that we can contribute to the industry and bring more awareness of what we could do and the causes. So allergic reactions. These can happen immediately, weeks later, or decades later. If you think about what an allergic reaction is, it's your body's response to something foreign, and it's reacting to it. And ink is foreign, as well as some additives or the carrier in response to implanting ink. So there's a lot of things that can contribute to it, as well as your own immune system and hormones changing. You can react to just having hormonal changes in your body. Even pregnancy. I have a client who her tattooed, half of it disappeared when she was pregnant. It was a dolphin tattoo. Now she has half a dolphin. So it just was her body, her immune system responding and fighting this foreign ink or object in her body. Also, it could be like surgeries. When you have like a knee replacement, you know, your body starts to reject, because that, again, the knee replacement's foreign. So it starts to push out that immune response to reject anything foreign in the body, including the tattoo ink. Reactions. Any ink, you know, there are inks that are cleaner and what's called MRI safe, which has no metals in them, or that have been surgically purified, like Intense inks. Mario Barth, the creator of that, made sure that his inks were surgically purified. So there are better options for ink that are pure, but again, if it's not recognized in the body, or if your body has a sensitivity or has an antigen buildup, then it's going to fight that. So it's any inks. So you just have to know what to look for. And one of the risk potentials is actually the metals in inks. Red is a high reactive ink. So typically you're going to see reactions with red inks and also black inks and even titanium. So those are the most probable ones, but it can happen, again, with any inks. It can be also the carrier that you're using to implant ink into the body. It could be chemicals that are included in it, or contaminants. There's been so many recalls on inks, you know, for even having viruses in them that can cause this immune response or allergic reaction. So these are some things or components to look for. Types of reactions. So we have our acute. This is something that, you know, it's immediately response. You see the arrhythmia or redness. It's probably hot to touch. Let me make this screen bigger, I'm sorry. It's slightly swollen. You know, you can definitely tell that there is an immediate reaction here. Photosensitivity. This usually happens with yellows, whites, and reds. And you could tell right here where this was actually yellow, but because of the sun, it reacted, the photosensitivity. Dermatitis. Okay, you could see the reaction all around. And this could be something that you came in contact with, like a contact dermatitis. But it could also just be the reaction, again, immune response in your body to the specific inks, carriers, or contaminants. But this is a presence of red, oops, and the little papules or bumps around. Lichnoid reaction. This one, you can see the little bumps. This one's rare, more rare, I should say, than typical reaction, but it does happen. And again, you can see it's happening with red. I've also seen several clients that this tends to happen, or it tends to raise up during their cycle. So women, hormone changes, it tends to just raise up during their cycle and their body responds to it. Okay, so this one is a delayed reaction. This was over 9 months. So he had the tattoo, it didn't react. 9 months later, this is what you see. So again, it could be something that's going on in his body. He could have got another tattoo. He could have autoimmune condition where his body's attacking and then it turns on it. It could be any foreign substance, a viral infection, but 9 months later, this is what happened. Again, it could be contaminated, it could be the red ink. So delayed reaction, you see coming up. Actually, 10% of the population have some sort of reaction. So it is good to know how to respond and what to look for. Granulomas. This client had her permanent makeup over, I want to say 12 to 16 years. Leah, our trainer in the UK, will be going over actually this specific removal process. She went to her dermatologist. Again, all you can do for a reaction like this typically is surgically remove it, which that is a very delicate area to remove, or steroids, which he was worried about it becoming a hypotrophic scar. And she luckily heard about Xtract, and we were able to remove it. And her physician was very, very impressed, and it's well documented. And this was under the guidance of Dr. Ben, myself, and her acting physician. But with the granulomas, it's not only a macrophage, your scavenger immune cells that are fighting this, but it's your fibroblasts. So it built up. And this was 4 millimeters in some areas. So it's really raised. And we are seeing this more and more common. Sometimes it's misdiagnosed as just keloiding. But if you look at the tissue underneath, you could see that it is the encapsulated granulomas under the tissue. This is also becoming an issue with aesthetics with microneedling. You're pushing in product that is not bioavailable or foreign to the body. And there's been cases of that where you get the granulomas all over your face. There was one particular with a vitamin C and microneedling that caused granulomas all over the face if it wasn't bioavailable or if it was foreign to the body. Symptoms. So these are things to look for, which we kind of went over. So red and swelling. So again, it could be hot, itching. Could be excessive itching. Could be itching over just certain times where you're maybe hormones, or if you're in the sun, or it could even be like a sensitivity of something that you're eating. It creates an immune response to your tattoo. Smell like pimples or bumps. Scaly, it just keeps peeling, raised, and sometimes that's a granuloma response too, even though it doesn't look as raised. It could be a scaly, cracky. It's what's happening under the surface. Deep lumps, blisters, skin crust, flakes off constantly, watery fluid leaking in that area, and that could be from it cracking. And this is a higher chance of it becoming infected too, which is a bigger issue. So with our removal process, and if you're not familiar with it, this is our 6th webinar. So we have 5 previous that goes into depth of how we remove our ink and scar tissue and allergens. But I want to point out the 3 components of our technology that aids in the removal of allergens. Our first one is in our activation serum, and this is our patent pending technology, is 1,3-beta-glucan. 1,3-beta-glucan comes from this cell wall of yeast. It triggers your body for an immune response. It also is an immune modulator, and it neutralizes allergic reactions and immediately aids in the healing process. It also is anticoagulant, so it doesn't clot the blood so the oxygen could come to the area. It accelerates the proliferation, so you're pushing out what doesn't belong there and remodeling of the skin. But this is an immune response. And what is an allergic reaction? It's an immune response to something foreign. Well, this 1,3-beta-glucan is increasing those macrophages, and it's like, okay, guys, let's go. This is not supposed to be here, and it's pushing it out. And because of our method of needling, and we also have our next component, which is bentonite clay, which is a chelation ingredient. And chelation is basically binding of ions. And bentonite is very gummy in consistency, so it pulls with electromagnetic charge from surrounding tissue, and it brings it to the surface. So we stimulated a macrophage response with the 1,3-beta-glucan. And now we have the bentonite to go and clean out all the surrounding tissues to minimize that reaction. So it's cleaning house. And it's also been known for many years as the healer. And as you can see from this picture, it's very healing, even just topically, which we also apply topical mask at the end to help heal it, removing and neutralizing any toxins in the wound or surrounding area. And then we have our patented technology. This is Xtract Heal. This is epidermal repair, so it repairs the epidermis, but it contains a patented ingredient, which is called trioxylene. I'm going to go to the next. Trioxylene. If you could see from the chemical little equation, it's 3 oxygen, trioxa. So trioxylene. This process is made with wormwood, an extract of wormwood that has been pressed through, drawing a blank, ozone, sorry. It's been pressed into caprylic, which comes from coconut, through ozone therapy. So it's adding oxygen. And if anybody out there knows about ozone therapy, it's so healing because it is a stable form of oxygen. So we put this heal actually even on lower extremities or areas, say a diabetic that doesn't have that oxygen supply in to help heal wounds that fast. We will apply this to bring more cellular oxygen to help aid in the healing process. But as far as allergic reaction, this is going to, again, neutralize any, response or neutralize any toxins. It's going to calm down the inflammation. It accelerates wound repair. Again, it's oxygen. And wormwood is, the extract is known for autoimmune, and it works right with allergic reactions. There's many studies with wormwood and HIV. Actually, Dr. Ben's patent for that, there's many studies for HIV and Africa with the trioxylene. So we are able to put this on, no bacteria can live in the presence of oxygen, no pathogen. It really helps to heal the immunity. It's a great tool to have if anybody has any excess inflammation, even just with the removal process. But with the overall allergic reaction, immediately put this on to aid in the healing. And all extracts methods and technology is holistic. We're just working with the skin to give the tools and the nutrients that it needs to heal and repair. Okay, this is a laser removal. I had a really good picture, but after they were trying to remove this particular tattoo, you can see in the surrounding area it's spread. So allergic reaction, you don't want to blast it throughout the body because then it creates a whole immune response. So with Xtract technology, we're bringing it through the surface, not to stir it up in the body that creates that immune response or autoimmune condition. This was an ink removal or red ink removal. It was very itchy for her, and we were able to remove it after one. Well, she had immediately relief after the first removal. And this was 6 weeks post one treatment of Xtract. This poor girl, this case was very meaningful for me. We were in the testing phase of Xtract, and somehow this beautiful woman heard about us through her dermatologist. She had a reaction for almost 2 years. Her eyes would swell shut, as you can see from this picture. This is what she looked like for 2 years. And her doctor administered steroids, and he's like, I can no longer give you any more steroids. You can't be on it for long term like this. And he heard about Xtract's method and sent her to us. And we were able to remove, and she would accelerate the reaction every 5 weeks. So I do think there was a hormonal component to this. Her placement of her PMU was not great either. It was into her tear trough. So it was a little harder to remove, but with Xtract's holistic method, we were able to remove it. So the top is the before and the bottom is below. And the bonus part of it is her insurance covered this removal. So she was ecstatic, we were ecstatic that we were able to help her remove this and that her insurance paid for it too. Okay, this removal was in the UK, and this is the granuloma. And I spoke of it a little bit earlier on. And again, so she's had PMU, she's had her ink over 12-16. I'll have to clarify that with Leah. But this was the start of the reaction at the top. And at the bottom, or I'm sorry, in the middle, this is with the key right before the removal, and it was 4 millimeters. And at the bottom, this is 5.5 weeks after her second treatment. She's still waiting. She has a lot of titanium in it, a lot of old ink too, which again, that antigen probably responded. So, you know, a lot of people would critique this and say, oh, it was the ink. Maybe it was the ink, but there's a lot of factors in there. So we are very blessed to have been able to help her with the guidance of her dermatologist, Dr. Ben, and myself, as well as Leah and Leah's skills in the UK. So our next webinar, Leah and Erica and Julia are going to go over the process of actually how we're going to remove it, different things to prevent as far as what to look for in inks, what to look for in a technician, as well as your own immunity to, are you at the right time in your life to be placing ink? Are you a good candidate for ink? I'm just gonna shut this. Actually, I'll go back. So I believe that is all for my presentation today. And again, we'll have number 7 with going over the step-by-step of how to remove it. One thing I do want a disclaimer, there's severe allergic reactions or reactions to ink that include fever, vomiting, just an all over immune response. Those definitely have to be under the guidance of a physician. We can aid in the removal, but when you're having a fever or acute allergic reaction, we do have to have it under the guidance of physician as well. So there is no questions. Wonderful. So thank you for joining me, and stay tuned for next week when we will go over in depth of how to remove the ink allergies. Thank you. Have a great day.